According to the National Institute of Mental Health, 20% of youth ages 13 to 18 live with a mental health condition. In fact, half of all lifetime cases of mental illness begin by age 14. Statistics like these inspired Pine Rest to open a new child and adolescent mental health clinic on Forest Hills in Cascade. I got a chance to visit and speak with Tory Seif, who manages the new clinic, and I asked him whether those national statistics hold true here in West Michigan.
Yeah, we really do. We're not different from other areas of the country in that sense. We tend to see some of the same frequencies and disorders that you see in other populations across the U.S. And so I think maybe one of the small differences is that because of our weather patterns and some of the stresses that go along with living in Michigan, that we see a little bit more depression than some of the other areas of the country see. But
why is it that it sets in so early? What do you know causes?
Lots of different factors, of course, right? So there's certainly always going to be dispositions and genetic things that play a role. But youth face a lot of pressure nowadays, more so, quite frankly, than when you and I were younger. There is greater academic pressure, there's greater social pressure. With the onset of social media, people are always around, always expecting, always kind of judging what's happening. And those have impacts on people's mental health.
Types of conditions, you mentioned depression. That is a biggie, I know.
Certainly.
What else are we talking about for young people?
Different forms of anxiety. We've seen, particularly in this area, an increase in the number of anxiety disorders. And so school phobias, obsessive compulsive disorder, generalized anxiety is that kind of stress reaction that kids are having to what's going on. So that's certainly one of the things we've seen an increase in. But also some of the more complicated things like bipolar disorder, autistic spectrum disorder. We see quite a wide range of things in our offices.
As a parent, I'm sure you might notice some of the symptoms that accompany any one of those disorders, and yet it's a phase. You hope it'll go away.
Right.
You hope that they join a club, right? Find their place. But how important is early intervention in terms of helping them either live with or move forward from this?
Yeah. So early intervention is a very big deal, for sure. And at the same time, those things you mentioned, kids getting involved, being a part of a club, being part of a group, connecting socially with other people is exceptionally important. If parents have a question, they should start asking those questions. Talk with a primary care physician, right? Phone up the pediatrician, get an appointment, ask a few questions. Speak to the school counselor. Most of our schools in the area actually employ some level of school psychologist or social worker that can answer some of those questions. I've never had a provider say, boy, I was so frustrated that a parent asked me if their child was doing well. They welcome those questions. They want to educate families and parents, and so it's never bad to ask a question.
So in terms of the experience of having a child assessed, you think there might be a problem. What's to be expected, and how do we make this happen in a timely way?
That's a good question. There's a lot of mystery for people sometimes about what it looks like to be assessed. Right, I'm going to go into an office. They have ideas in their head from friends or family or even movies about what that's like.
And you worry about the stigma too.
You really do.
Yeah.
It's pretty simple, actually. I mean, you can get an appointment by calling any of the mental health agencies here in town. Pine Rest has central numbers to call to be able to be reached. You get an appointment with a psychologist or a social worker, and it comes down to basically a pretty in-depth conversation with somebody. And so if you're dealing with a child or a teen, families come in, parents speak with us, the children speak with us. It's just a long conversation about what's going on in life, how they're reacting, what they're feeling, and that's how we begin things.
And then is it always with the parent and child? Because I think parents always wonder that too, like, am I going to be able to be a part of this, or is it necessarily, maybe I shouldn't be?
Right. And that varies certainly by families. I have some families that I work with where parents want to be very involved. I have other parents that say, I'd prefer they work with somebody who's a little bit more objective than me on this. And so counselors always take into consideration what it is that a patient and a parent might want for those circumstances, and every clinician's a little bit different on those things. But we highly encourage parents to be involved, whether that's 5 minutes at the beginning of a session to check in with us, or being a liaison and an advocate with us for the school system and for their primary care provider. We want parental involvement for sure. I have some times that I'm doing family therapy, so the entire hour is spent with both parent and child. There are other situations where it might go 3 or 4 weeks where the parent's just out in the waiting room the whole time because it's fine for their perspective, and what the child and I are working on is much more individualistic about what's happening in their life.
The good news is that you can help people manage even the youngest, right? You can find solutions for them.
You can, but whether it's accessing things in the office or helping things change at home or at school, we have patients here as young as 4 years old that come in to work on different behavioral problems or different symptoms that they're experiencing. And so there's a lot that can be done, and it's not invasive. It's little techniques, it's little tools, it's ways of thinking differently, behaving differently, that long term especially can make a huge difference in someone's life.
The Child and Adolescent Mental Health Clinic participates with most health insurance plans. You can make an appointment or learn more about Pine Rest on their website. We've put a link to it on ours at 13onyourside.com.